everyone, and welcome to today's webinar on pregnancy and infant loss, how your support can make a difference. My name is Andrea Bodkin, and I'm a Senior Program Specialist at Public Health Ontario, and I am moderating today's session along with a wonderful co-moderator from PHN Prep. I am coming to you today from PHO's office in downtown Toronto, which is Treaty 13 territory, but we have folks coming to us from all across the province today. So rather than telling you about where I am, I'm going to invite you to take a moment to consider the land that you're on today. Consider the land, the waters, the trees, the sky, the rain, the clouds, the sun. Acknowledge the history of the land that you're on today, the First Nations, Inuit, and Métis peoples who originally inhabited the land and whose lives were changed by colonization, ongoing colonialism, and structural racism. Consider also those who were forcibly brought here through the transatlantic slave trade and those who have chosen Canada as their home. Consider your own privileges and how you may be able to commit to reconciliation, cultural safety, and anti-racism. I'm going to go over a few housekeeping items to ensure that this is an engaging and optimal space for you to pay attention and learn from today's webinar. We have disabled the Zoom chat and audio video features. You can request or submit rather any content related questions in the Q&A function, which is at the bottom of your window. And the questions will be addressed during the Q&A period following the presentation. If you have any technical issues today, you can email capacitybuilding@oahpp.ca. I'm going to introduce my wonderful co-moderator for today, Lindsay Croswell. Lindsay works with PHN Prep and currently is with Middlesex London Health Unit. She has been part of the Nurse Family Partnership Program since its inception 17 years ago. Lindsay, thank you so much for being here today. Please take it away.
Thank you so much, Andrea. I'm honored to be here today. I'm thrilled. Thank you for the opportunity for co-moderation, and I'm honored to represent the work of the PHN Prep team in supporting PHNs, supervisors, managers, home visiting specialists, and all the other nursing staff in their work with families. It's now my pleasure to introduce the speakers for today's presentation, Michelle Lafontaine and Megan Faulkner. Michelle Lafontaine is the Regional Program Manager for the Pregnancy and Infancy Loss Network and is a passionate advocate, speaker, and leader dedicated to raising awareness, providing support for individuals and families impacted by pregnancy and infancy loss. Having personally navigated infertility, miscarriage, and the devastating stillbirth of her twins in 2005, she brings a unique perspective to conversations around grief and bereavement. Megan Faulkner is a registered nurse with 17 years of experience, first as a labor and delivery nurse, and later as an advanced practice nurse in a high-risk obstetrics at Sunnybrook Health Sciences Centre in Toronto. As the manager of the Pregnancy and Infancy Loss, or PAIL, network, she provides leadership to the team and contributes her expertise in education, research, and resource development. Pardon me. I'd love to hand it over now to Megan to begin.
Thank you so much, Lindsay and Andrea, for the warm welcome. Michelle and I are so pleased to be here speaking with you today. As a registered nurse who started out her career in labor and delivery, and then in high-risk obstetrics outpatient clinics for the last few years, I have really been able to closely see the benefit and the amazing work that public health nurses do and home visitors. So really happy to be talking about pregnancy and infant loss today with you, because the role that you all have in supporting families is so important. And so we hope that you hear that from the message today. We hope that you get to take home some practical tips and that you gain some confidence when you're supporting families. Just a really quick disclaimer that this presentation was created by Michelle and I, PAIL Network. This is our thoughts, our opinions, and our research that we've completed. We have a few learning objectives that I'm going to go through quickly. First of all, we are hoping that when we speak with you today, we provide some background on the impact of pregnancy and infant loss on families. And the hope is that once you have some of this information, or we confirm some of what you already know, that when you are in front of a family or providing support to a family, that you understand a little bit more about their experience, and then how you as a nurse or as a home visitor or as someone who's working with the family at that time can provide compassionate and skilled support. We want to talk a little bit about communication strategies as well, because we hear from professionals that this is something that is often anxiety producing. We don't want to say the wrong thing. We want to be able to support families. And so we are going to talk about communication as well. We want to talk about professional boundaries around perinatal loss. And mostly what we mean by this is ways that you in your role can engage with families and feel confident in doing that around a topic that is often really stigmatized and challenging for families. We also want to talk a little bit about pregnancy after loss, because we know this is something that you will often see in the work that you do. This is something that is a topic that is very near and dear to my heart. For the past 8 years, I was working in a maternal fetal medicine clinic with families during high-risk pregnancies, and I was running a program called the Subsequent Pregnancy Clinic, and it was for families who are pregnant after loss. And again, the role, the impact, the support that public health plays for families during subsequent pregnancy cannot be understated. And so we want to talk about that again, knowing that this is something that you will see often in your role, and we want you to feel confident with the support that you're able to provide. I want to talk a little bit at the start about PAIL Network and who we are and what we do, because I know that for some of you, you might know this, and for others, we might be a new organization. We are a government-funded organization that is based out of Sunnybrook Hospital in Toronto, but we are a provincial organization. So what we want you to take away from this is that any family or professional in Ontario is able to access the resources and supports that we provide. So you don't have to be affiliated with Sunnybrook in any other way. We were started in the 90s by a group of bereaved parents whose babies died. And when they were in the hospital, they felt like they had a bit of support, and then they left and went home, back to their home communities, and they found that support was not what they were needing. And so they got together and started essentially the foundation of where we are now. We have always provided peer support for any family in Ontario who experiences a loss for any reason in pregnancy and up to 1 year of age, infant loss. We have a whole bunch of different supports that Michelle is going to talk about at the end, so that you know if and when you should be referring a family, or if it would be helpful for them. We also provide education for health and service professionals. So we do webinars like this. We have what we call a compassionate care workshop, which is a full day workshop that we do all around Ontario twice a month. We are often hosted by hospitals or public health departments, and we provide teaching and education. We also have some online online modules for people to complete, and we have started simulation. We have written resources. We're going to talk a little bit about that. Encourage you to reach out to us as well if you're looking for additional education. And we also have always provided and continue to provide awareness and advocacy. Pregnancy and infant loss is a topic that is stigmatized and that often feels isolating for families, even though it is something that happens a lot. And so we provide events and advocacy where we speak out about the needs of families a lot. And so these are the 3 tenets of what we do, the foundation. And again, we'll give you some more information towards the end. I want to talk a little bit about statistics. For some people, when they see these numbers, they say, yes, this makes sense. This is what my experience has been, maybe personally or professionally. And for others, these numbers are surprising. What we know from the literature is that as many as 1 in 2, 1 in 3, 1 in 4 pregnancies end in loss. And we have some information here for the 2016-2017 fiscal year, that there were over 38,000 visits to ER departments in Ontario that were related to early pregnancy losses. These were the top 3 categories of reasons for the visits. And what this equates to is 106 visits to ER departments every single day across Ontario, or 1 family every 14 minutes. And this is for losses that are 20 weeks and under, so related to what we call early loss. In terms of stillbirth and infant death, we know that 8 babies are stillborn every day across Canada, and 5 babies die within the first year of life every day across Canada. And this is 1 baby, 1 family every 2 hours. And again, the reason why I think it's important to start out with these numbers is because I think it acknowledges the number of people who are impacted by pregnancy and infant loss, and that as a professional, you will absolutely be supporting or working with families who have this as part of their history. And so knowing that it's common often, and that this is something that happens to many families, I think is helpful for us when we are thinking about the questions that we're asking, the supports that we're providing, and the ways that we are approaching families. In 2015, there was a big change for PAIL Network in terms of resources and support and funding through the Ministry of Health. There was a provincial bill that was passed, the Pregnancy and Infant Loss Awareness, Research and Care Act. There was a member of provincial parliament, his name was Mike Cole, who had a personal family experience of loss, and he and his family discovered that there weren't a lot of resources and supports, and so he set out with a private member's bill to make a change. In 2015, that bill passed, and what that did was resource PAIL Network in a new way. Previously, we were mostly relying on volunteer support and grants to run the organization. And so in 2015, when we became funded, that allowed us to do a bunch of different things, including asking around Ontario professionals and families about the gaps in services and what PAIL Network should be doing moving forward in terms of resources and supports. And so in 2017, we had a series of focus groups, and we asked families and professionals about the types of services they would like to see, what we could potentially do to make a difference for families. And we also did we did an online survey around the province. We had almost 600 families respond to this survey. And up here on the screen, you will see some of the summary results that I'm going to talk about. If you're interested in reading the study, it is open access, meaning that it's free. There's no paywall for you to read it. I just want to say that as a nurse and speaking to other healthcare professionals here today, or professionals, I know that these numbers are a little bit hard to read. I can't say when I saw the results I was surprised, because I've been hearing from families that there are gaps in the systems. However, I know that most of us go to work every day looking to do our best. And so seeing that there are these needs that are not being met can be challenging. So I just want to acknowledge that we are going to talk about what families told us, both where there are gaps and also what we can do to close those gaps. So of the 600 families, we asked them about their loss, around the time of their loss, and then also following. And over half of the families reported that at some time during their care experience, so this was either with a healthcare organization or with the healthcare professionals, that they did not feel like they were treated with kindness and respect. 72% of families told us that they didn't feel like they received the information that they needed from healthcare professionals. 65% reported that at some point in their journey, they did not feel supported or cared for. Almost half felt that they were not told of available supports or did not remember being told of available supports. Almost 70% felt that their healthcare provider at some point in their care journey did not have the skills needed to respond to what they were wanting. And over half reported at some point experiencing stigma from a healthcare provider. Again, really hard to see these numbers. I think that a takeaway message is that there is lots of opportunity for improvement. And I'm hoping that you're able to see the role that you have in supporting families in some of those improvements. And so Well, we know that if you know that families might not remember being told of available supports, let's say at the hospital, and that you are the person who is going to be following up with them or journeying with them for the next little while, there's an opportunity for you to provide supports for families. Feeling that they didn't receive the information that they needed. I know public health nurses and community health nurses are really good educators and teachers. And so here's an opportunity for the system and for a professional to come alongside a family and provide that information that was maybe missing during that time. A little bit about what we know as risk factors. Again, hoping that this helps in the back of your mind when you're with a family, knowing whether or not they have risk factors or protective factors. We know that experiencing depression or anxiety can be a risk factor for having a challenge with coping, extra challenge with coping with loss, experiencing traumatic stress, having a history of a previous loss. And so this is something that you might discover when you're doing an initial assessment on a family. Having conflict in a relationship is a risk factor, and pressure to have another baby. We often hear from families that people like to hear a positive ending to the story. So if you have a loss, hopefully you'll get pregnant again, or when a family gets pregnant again, or if they do, some people assume that's wonderful. Now we're moving on from that loss, and that's not necessarily true. Protective factors, having a living child, access to specialized support, which is really obviously an area where our teams can support families, satisfaction with health services, and what we know from what families have said, that if you have a professional who cares, who makes connections for you, who asks you about your loss and provides information, this is really protective for families and supporting them at the time of their loss. Connecting with others who have similar experiences. There is a lot of evidence for peer support, specifically in pregnancy and infant loss, and as well as having strong social support. So either with their partner and their family, community, or to a spirituality or religious connection. Again, want to reiterate the difference that you have a chance to make with the families that you are supporting. We know that there is so much evidence that the interactions that families have with professionals and with the system have long-term implications on their well-being, and this is both positive and negative. You are an important source of support, and I know with the intimate nature of the work that you do, you might know a family and have information about them or about their loss that many other people might not have. So they might not have disclosed to their workplace that they were pregnant. They might not have disclosed to others that there's this loss. And so this is information that you might have, and you might be one of the very few people who have that type of information and an ability to support them. And you will forever be a part of their story. And so although for some this feels like pressure to get it right, we hope that this actually feels like good news and is good news for you, that the role that you have is really, really important. Want to talk quickly before we talk about some ideas for support for families. The concept of attachment is really, really important to understand when you're providing support for families. And what we know from what families have told us and from the literature is that the amount of grief that a family experiences around the time of their loss is not related to the length of their pregnancy. It is related to the depth of their attachment. And so this is why, even if a person has an early pregnancy loss, they can still grieve it very deeply. And so as professionals, we don't necessarily know where a family is or how much they have attached to the pregnancy, but there are a series of questions that we can ask or ways that we can listen to determine that, and then that can help us to match the supports that a family needs. I know that I have heard people say, she was barely pregnant, I don't know why she was so upset, or even for some families, there might not even be a pregnancy when we think about the fertility world. This rainbow road is sort of a visual of the attachment that often happens before a pregnancy begins. And so there's often investment in maybe finding a sperm donor. There's often a lot of financial resources that go into trying to become pregnant. And so for families, if you see them at the time of their loss, there's a lot of history that goes into that. This image of this child with a doll, and particularly for some people in some cultures where parenthood, motherhood, fatherhood is a really, really important aspect of their identity. When you're a little kid, you dream sometimes of growing up and meeting a partner and having a baby. And so attachment starts early. It is the loss of a dream or a life or something that you visioned for yourself. And so it's really important to not assume, and it's really important to know that families can be deeply attached to pregnancies at any stage. And although that's not true for every person, it might be different pregnancy to pregnancy, that if you know that and know that families might need support and that they're often not offered support when they encounter the system, I think that this will help us to ask better questions and to make connections for families where previously connections were not made. So now that we've talked about what families have said the gaps are, we want to provide some suggestions for connection. One of the things that we often hear from families is that they see all of us as part of the same team. So this may be when a family is receiving antenatal care, they go to a hospital, and then they go home. When there aren't transitions that are smooth, or when people don't have information that is shared amongst them and families have to repeat themselves, that can be challenging. And this is especially true for families when there is a loss. And so if there's anything that you can look at and do to smooth transitions, for example, improving the way information is shared amongst your teams. I have heard from some public health departments that there are really, really great connections with their hospitals, and that even some of the public health nurses will actually go in physically to the hospitals to meet families then. There's these types of innovations that can happen. And so looking at systems sometimes, taking the onus off the family to have to be the one to share information is really important. And if you find that when you're receiving information from your local hospital or organization that's supporting a family and you don't get the information you need to make the call in a confident way, there's maybe an opportunity to look there. Options for timely care, including follow-up. We know that the hospital is just a moment in time in their journey. And so anything that we can do to provide timely connections for families. We often hear families will say, if I had a living baby, I would receive, these sorts of supports or services, but because my baby died, I'm not a priority. Anything that you can do to improve that and to improve the follow-up that a family can make. Again, it's another connection, opportunity for resources, support, and information that the family might not have. Having access to knowledgeable, skilled caregivers who listen to them, who acknowledge all dimensions of their well-being, including the physical and emotional. We hear a lot from families, this is around the time of their loss or just after their loss, that they are surprised at lactation. I know that sometimes they are spoken to about that in the hospital, but that they go home before it happens and they might not remember. It is distressing for families, and we hear this still to this day. And so if this is an area of your practice or you are in seeing families around this time, talking about the physical components of it again, asking families how they're doing can be really supportive and helpful. To be told honestly what to expect and what to do next. Remember, there was 70-something% of families who felt that they weren't told about next steps or what was coming. Anything that you can do to provide guidance or anticipatory guidance about what's to come is really supportive and helpful. It can be a gift for families. And then providing guidance and information to help families understand the process can be really, really helpful because, again, families might not receive that information or remember that information at a time that is very often chaotic and disorienting. Many families are not expecting to experience a loss, obviously, and so anything that you can do to slow things down, repeat information, help them understand what's coming and provide connection can be really, really helpful and supportive. Talking about ongoing supports, this is where public health is so, so important. These ongoing supports and connections, we know from families that reaching out for support can be really, really hard. And so we often at PAIL Network say anything you can do to reduce the onus on the family for reaching out is really helpful and supportive. And so this looks like calling families, sending them something in the mail, making that connection, offering yourself as a safe space to chat and to provide information. anything that you can do to provide ongoing connection and support for families through subsequent pregnancies and through parenting after that is really helpful. Using sensitive language, again, we're going to talk more about communication, but what we hear from families is that they love hearing people say their baby's name if they have named their baby. Watching language and sometimes going over language they potentially will see in reports. And so, we know from families that they have access to their medical records a lot. And so they might see terms such as spontaneous abortion and be shocked by that. And so talking about medical language, if they're going to see it or hear it, and helping provide guidance around that is important. Using their baby's name, documenting that so that if there's another nurse that potentially is covering for you, she knows their baby's name and is able to use that. Really, really important and helpful. A small thing that you can do that makes an impact on a family. Again, to be treated as individuals, this idea that as a nurse, as a professional, seeing a family, you might not know, or you won't necessarily be able to know the depth of attachment that they had or how they refer to their pregnancy or their baby. And so recognizing that everybody is an individual, there's no one way to grieve, normalizing that for families is really helpful. There are decisions and choices that families will need to make that they never have thought of before. And so, for example, sometimes I will say, have you thought about what you want to do with, a memorial for the baby? And sometimes they'll say yes or no. And then you can say some families choose to do this, others choose to do this. There's no right or wrong way. So normalizing and providing options for families can be really, really helpful. And then just acknowledging their loss, their grief, their baby, something that wasn't ideal if they didn't have the connection that they felt that they needed in the hospital. Trying to make those connections for them in the community is really, really helpful. And acknowledging that it's okay to grieve and that there is support out there and that they are worthy of support, particularly if the message that they received from the healthcare system previously was that their loss wasn't a big deal, or that it's strange that they're grieving this. Anything that you can do to provide these connections and resources is important. One other thing that I think is useful to mention is that the idea that there is a family often are involved in the loss. If you have skill in supporting children or talking about partners or relationships and how there's differences in how people grieve and the resources and supports that people might need. Often families tell us that no one has spoken to them about that in the hospital, particularly if there's a focus on the physical nature of the loss. And so if you have an opportunity to talk about that and to provide resources to talk about children, how they can talk to children about the loss, how they can break this news to schools or daycares, how they can talk about it with their friends, and anything that you can do. Asking these questions, showing that you are a safe space for these conversations is really, really helpful and supportive for families. And again, providing connection at any time that you can, local resources and supports. If a family feels that they may benefit from peer support, referral to PAIL network, and professional support as well, if a family is able to access that. I'm going to now turn it over to Michelle.
Thank you, Megan. I'm really happy to be able to take over this part of the presentation because this is an area that is really so very important for families to know that they have support and to describe pregnancy after loss as a real paradox. After a perinatal loss, most families will become pregnant again. And what we found in the literature is that 50% of those families will become pregnant again within the first year after their loss, and 80% within the first 18 months after their loss. And so while that is a real time of hope and joy for many families, being pregnant after a loss can be a very, very high stress and anxiety ridden time for a family. I can certainly speak to my own experience and knowing that this pregnancy was now high risk after my stillbirth, that I needed to be in and being monitored very frequently. While that gave me some reassurances that we were going to be able to see what was happening week over week, I really had very, very high stress levels. And so what we see in terms of symptoms of depression and anxiety, having those guarded emotions. So really feeling fearful of allowing yourself to attach to this pregnancy, attach to this baby that you're pregnant with after you have experienced loss. I really felt that families were expressing that to us very frequently, and that need for assurance and reassurance. And so if you can think about how to support families who are pregnant after a loss, consider that while they do want very much to be able to enjoy this pregnancy, it may not be a time that they had anticipated or really hadn't thought about how stressful it might feel for them. What we also hear from families is that they, in their own loss journey, they remember the week of gestation that the baby died. And so you start to think about, that's the safe place that I have to get to. And so for me, that was 21 weeks. And I felt like if I could just get after the 21 weeks and everything would be fine. And I was very surprised when I reached that 21 weeks and my anxiety didn't go anywhere. And then I was further surprised when I did have a living baby that anxiety didn't go anywhere after that when I began to parent him as well. So a lot of what Megan has already talked about in terms of support, acknowledgement, those things are just really important to keep in mind. More supportive considerations to offer to families in these kind of specific areas, a lot around guilt and shame, that families will start to feel that they could have done something differently or should have done or not done something. And so messages from you around what happened to them was not anything to do with their fault. There was nothing they could have done or not done to prevent this pregnancy from ending or to prevent their baby from dying. Again, looking at the family strengths, Megan talked about some of those protective factors, and highlighting that for families can be important. The language aspect of things, that the use of jargon or medical terminology is often something that professionals will kind of feel more comfortable talking about. And so really try to follow the family's lead in terms of how they talk about the pregnancy, how they talk about the baby, and using the baby's name to really mirror what the family has been communicating is a good way to move forward that way. Sometimes just the acknowledgement that what happened is not okay, and that they are certainly entitled to and deserving of and validating their need for support. Sometimes we hear from families that just receiving information about support is enough to make them feel that this loss is deserving of support, that they are not alone in this. There's a whole organization of families who come for support after they experience pregnancy and infant loss, and they don't need to go through this alone. I'm talking about the impact of previous losses when a family is pregnant after their loss. So to recognize that this will impact in a ripple effect across the rest of their lives. And so we do hear from families that when they are trying to then parent after their loss, the worst thing has already happened to them. And so what is to save them from anything terrible happening to their children in the future? During the pandemic, we heard from a lot of families that had living children that they were positive that their child would be the one to die from the COVID-19 virus. And also to know that when families are presenting back into healthcare spaces again, that they previously experienced loss in these situations, or even sometimes in those specific locations, can be very triggering for families. And as Megan described, the physical aspect of what is happening to them is really important for someone to give them information. Families don't know what they don't know. And so many families will describe this as a shock. They had never even considered that their pregnancy would end or that their baby would die. So to give them information about what's happening to them physically, what's happening to them emotionally, what's concerning and what is typical is really reassuring for families. The loss of control and the loss of safety, families will often talk about how they have gone through all of this pregnancy doing everything quote unquote right. They tried to eat the right things, they tried to get exercise, they took all of their vitamins, they did all the education, and yet the baby still was born not alive, or their pregnancy ended far too early. And so to move into other spaces where they felt like anything that I could do to gain some of that control, to give that back to families in any way. So offering them reassurances, offering support more than once at the family's pace, and to provide them with clear instructions about what to do and what not to do. Make sure they have information in lots of different formats so that they can have something to look back on, ask the same questions of you over and over again. And what we'll talk more about in the next couple of slides is really about connection and communication. So what this slide demonstrates is really a chart that shows the intended message and how that message has been received by families. And so there is a gap that exists between that intentionality and how families will receive that. And what you'll see then is a lot of those platitudes, or perhaps you will see things that you have said to families in the past with the very best of intentions, to know for families that when they are being told something like, it's okay, you're still young, you can have more children. I remember being told, well, at least now you know you can get pregnant. That was not helpful to me, did not give any kind of support. And in fact, most of these platitudes tend to invalidate how a family is feeling and make them feel like what they are experiencing is not okay and that they should really kind of pull through and push past this. The thing that I will highlight the most on this slide is when nothing is said. And so silence is absolutely deafening for families. When families leave the hospital or try to get back into their lives that they were living before their pregnancy, to really help families to understand that what is happening to them is real, and that they have every right to feel all the things that they are feeling, that there's no right or wrong way to grieve, and that there are ways that you can support them in learning how to integrate this loss into their lives in a way that is meaningful for them. I think the intentionality of what we say to families is really to try to help them to feel better. And what we want you to think about is that there are no perfect words that you will be able to say that will take this pain away from a family. And so really focus on the presence that you can have with the family, not thinking about what's the perfect thing for you to say in those moments. Again, here are some statements that we would encourage you to say, and having any of these conversations or saying these things to families, when you're able to say them in a moment of connection, will have a much deeper impact and be more important to families than things that you can say kind of off the cuff. And so right off the bat, saying to a family, I'm sorry, or I'm sorry for your loss, imagine how that would feel to a family if they disclose that they've experienced a loss, and then your response is, I'm so sorry for your loss. And then you just move on to the next question that you have in your intake sheet or the goals that you had set for that family to work on in that visit. Instead, being able to stop for a moment, perhaps put your pen down or look up from your computer screen to say to the family, I'm so sorry for your loss. Is there anything that you would like to tell me more about? Or be able to offer some more information to a family about the services that you might be able to offer to them. To hold space for them is really such an important thing that you can do. Any of these things that you see on the screen here, when they're said in moments of connection, can really help a family to understand that you are a person that they can talk to about their experience of pregnancy loss or infant death. What families really want you to know is that even if they do have living children or they go on to have another baby in the future, that the baby who died was irreplaceable. For families, that was the loss of a member of their family that they had anticipated. They had started changing their identity based on having another child or perhaps having their first child. And that's really challenging for them when someone just moves on, especially after you hear that they've now had living children, that there is an expectation that that part is over and we've moved on, and now you must be happy now because you have a living child and that's what you always wanted. Using the baby's name acknowledges to the family that you know that they were here, and that underlines for them that they mattered. As a bereaved parent, the number of times that you get to hear your child's name out in public or said to you is so very few and far between, and very meaningful when it does happen. For families who are parenting their baby, that means that they are making decisions, ensuring that their baby is being treated with respect and care, and while they're in the hospital, knowing where the baby is at all times. And so for families who've experienced a stillbirth or a later term loss and have had to go through funeral rituals and being able to make those kinds of plans, it's important for them to know that location, where the baby is, and what will be happening all of the time. And they may ask you questions about that. And so if there were moments in the hospital where the baby wasn't in with them, they might be asking you, well, where did that baby go? Or where was my son when I was sleeping? Or who looked after him? And so to be able to answer those questions or get information about that for the family can be important. The non-birthing partner has a very different set of memories and really does need to have attention paid to them too. Certainly that is something we've heard over and over from families, that the non-birthing partner felt invisible, their feelings were not talked about or counted on. Dads have told us about going back to work and people just asking them, how's your wife? And not really considering that their baby died too and that they have needs that need to be met. This experience of pregnancy and infant loss can be easily described as chaotic, disorienting, and for over 80% of families, traumatic. And so to really recognize that families that you might have known prior to the pregnancy lost their behaviors, their actions, their ability to follow through or to remember appointments, those kinds of things are all very disconnected and may need more support from you to start. And support can be really hard to find and really hard to look for. So when families know that there's support that is available to them, that takes the burden off of them to first admit that they need support and then have to go out and find support. So we would ask that you please don't assume that somebody already told them about supports that are available, and it's always helpful to have that conversation again. For some families, they need to be having that conversation more than once and getting the information in plenty of different ways before they may be ready to access that support. The support that we do offer at PAIL Network is peer support. So we don't offer any professional counseling, and nor can we make referrals for professional counseling. But we certainly recognize that being able to connect with other people who have had similar experiences to you is important. You'll see in that one column all of our online loss-specific support groups. And so families who are self-referred to our website, through our website, are able to be connected with any types of support that they feel would be helpful. And our referrals coordinator will review all of this information with the family. We do also offer an Indigenous circle of support that is led by bereaved Indigenous families for bereaved Indigenous families, appreciating that the Indigenous population in our province have grief experiences that can be very difficult for non-Indigenous people to understand. And so we have been able to launch this online support group and would encourage you to send families this way. We do have in-person circles of support as well in various communities across the province. Pre-COVID, we had about 32 groups. Right now, we're about 16 to 17 groups that are across Ontario. And you can find that information on our website if families are interested to know if they have a group that is local in their area. Families can attend different types of support. So if there is an in-person circle of support, they can attend as well as attend their online loss-specific support group. We also, in recognition of the impact this has over a family's trajectory, offer other groups and different types of support. So we do have support for grandparents, we have support for partners, and we start to offer support for families when they're trying to conceive after their loss, as well as when they're pregnant after loss. And as I described in my own experience, parenting through loss was something that was much more stressful than I ever imagined it to be, and really felt like, well, now that I have a living baby, how can I still honor and grieve the babies who died? And so it was a really important thing for us to offer this group for families who do have living children, but still needed a place to connect. We offer one-to-one phone support for families as well, and we do very close matching to the type of experience, the geographic area that families live in, recognizing that the type of healthcare experience that somebody would have if they experience their loss in Timmins versus a family who experiences their loss in Toronto can be very different, and to be able to match them up in as many ways as possible. The other form of support that we offer is through our memorial events and advocacy. So every year we offer events for families. The next one coming up is A Walk to Remember. That's always the first Sunday in June, and that will be happening in a variety of communities across Ontario. And families can register for that on our website, as well as receive an individual kit if they would prefer to just walk with their own family or in their own neighborhoods. We have a number of printed resources that we have on offer. First, we have the brochures and posters that are available to you at no cost. The brochures and posters are translated into the top 6 languages spoken in the province, as well as 3 Indigenous languages. So you're welcome to go onto our website and order any of those resources in any of the languages that you have in your communities or that you think families might benefit from. The poster has a QR code. Families are able to just scan the QR code and be taken directly to our website. And each of our booklets that you see here are also translated into the top 6 languages spoken in Ontario and are available for you to order for $1 a booklet on our website. That's what it costs for us to print them, and so that's what we charge just to recoup those costs for us. Please feel welcome to go onto the website and take a look at them digitally if you wanted to see some more of the content, and all families who connect with PAIL Network are offered these resources to be mailed to them if they would like a hard copy. We have web resources that are available for families, and the first one is a series called Helping Others Understand Your Grief, learning from families that being able to have to educate other people when they're coming and saying, what can I do? What do you need? How can I support you? The burden of trying to educate other people on how to be supportive to them felt really high for families. And so we did create a series that has one for family members, one for friends, one for coworkers, and one for employers. The support for grandparents, that has now come into an entire group on their own, hearing from grandparents that they feel that they were grieving two losses, and not only were they grieving their grandchild who had died, but also the pain of watching their own child grieve. That pregnancy loss or infant death was very, very difficult for them. And so we do have specific support and information for grandparents. On our website, we also have an area that you can tell us what should we be working on. So if you go to our website looking for something and don't see it there, then we would love to hear from you about what might we consider working on in the future. The healthcare and service professionals education, we do have the full day compassionate care workshop that we offer. On our website, we try to make it as user-friendly as possible. And so we would encourage you, when you're working with families, to please go to our website and review some of the information that we have available to you on that website. The videos that we've created are a lot about families talking about the importance of memory making, communication, what was really important to them at the time of their loss, and pregnancy after loss as well. We do have simulation that we have started to offer for professionals to be able to really get more comfortable with how to communicate with a family at the time of their loss or following their loss. Webinars like we're doing here today, and also some education for students that we feel very lucky to be able to be a part of. We also have an e-learning module on our website that is focused on communication. It's self-directed, and it does produce a certificate of completion when you have finished. So if you're able to go through the whole course from start to finish, I would say that it's about 30 to 40 minutes in length, but you're also able to pause and come back to it at any time and pick up where you left off. The Early Pregnancy Loss Provider Toolkit is something that you can find on our website that is really a supportive way for you as professionals in any healthcare setting to be able to see that there are resources for you to give to families, and to think about supportive workplace changes that you might want to implement. Also, we'll give you more information about what the family's experience may have been when they were in the emergency department, whether they were able to access an early pregnancy assessment clinic, or what else they might need information about. Because again, to not assume that somebody else has given them information or provided them with resources, this is a way for you to support families that you're working with as well. On our website, we were able to then partner this year with the Ontario government to produce a stillbirth package. And this commemorative package is able for families to order at no cost. They can get a certified copy of their stillbirth registration, as well as a commemorative certificate that honors their baby who has died. These are the postcards that you see here on the slide that we have available for you to order at no cost on our website if you wanted to make sure that families who have experienced stillbirth dating all the way back to 1944, that families are then able to do that search letter and access that information. I will say that this is not a simple process for families to go through. It involves a pretty high degree of technology for you to be able to download this Adobe, complete the information, reattach it to an email, and send it back. And so at PAIL Network, we have a family support coordinator who offers navigation services and supports to access things in our system, just like this package. And so if you have a family that you think would benefit from some support to be able to complete that package, or if you're able to support them through that completion, then please feel welcome to connect them with us or to connect with us directly, and we can walk through that with you as well. The message that I really hope that you will take after today is really that we want you to know that you are not alone in this work. that this work is really impactful both for you and for the families, and that we are an organization that not only provides support for and resources for families, but support and resources for you as professionals as well. So we are always happy to hear from you. And we would really encourage you to consider following us on social media, joining our mailing list, things that you are going to be able to stay connected with us in the future. Thank you so much for your time, and we're happy to answer any questions that you have.
Thank you so much, Michelle and Megan, for that excellent and insightful presentation with so many support strategies that come from the families that you've supported and are based, in practice. We'll now move to the Q&A segment to answer questions from anyone joining us live. So as a reminder, if you haven't already entered a question into the Q&A pod and you have one, please do that now. We've had a few come in already. With that, I am going to take a look at the questions and then invite our speakers to answer. So the first question that has come in is around, I think a good way to frame it is the process maybe that we could expect in order to provide anticipatory guidance to clients or for us as nurses to know. This, I'm assuming as a nurse, had referred a client or encouraged a client following a spontaneous abortion to access PAIL network, I'm assuming. And they said after the initial phone call intake that there was no further phone call. And so obviously that's an unfortunate situation and we don't know the details, but I'm thinking then the question is really comes from what does a new intake look like and how can that be done really well to ensure that doesn't happen? So maybe just, I don't know if one of you want to walk us through what would happen there.
Sure, I'm happy to answer that question. So when a professional referral is made, then we have our referrals coordinator reach back out to the family, typically within 3 to 5 business days, unless it's been otherwise indicated on the referral form. When a family self-refers, then we are in touch with the family within 1 to 2 business days. The referrals coordinator will reach out to the family, go through all of the potential areas of support or resources that the family might be interested in. And it sounds like this particular instance, the family might have been matched with phone support. And that would be where a volunteer reaches out directly to the family to start that phone support. And unfortunately, there have been times in the past where there have been lines that were crossed or perhaps the wrong information was given. And so we would absolutely, if you learn about these things or a family has said, we are waiting to hear from someone, sometimes through email, things unfortunately from Sunnybrook, especially to emails like Hotmail or Yahoo, they end up in junk folders. And so we do try to reach out to families in a number of different ways, by phone, with a letter, and with an email if we haven't established that contact. So it's quite uncommon for a family to not hear back from somebody when that connection has already been made. And we would love to hear from you directly if you, on behalf of your client, if there is something that you were expecting and didn't happen, then we would like to hear back. Typically, if we have arranged for a family to be connected with phone support, then we also would follow up with the family if that never came to fruition. So if we were able to connect them with a volunteer and made those introductions, the volunteers also are back in touch with us to let us know what might have happened. And so again, I don't know the details of this specifically, but certainly we would like to be able to handle this on a case-by-case basis.
That's really helpful. Thanks, Michelle. Another question we had was someone who shared they lost their infant son last year. So to start by saying, I'm so sorry. And, thank you for sharing. And they were connected with the grief support team at Sick Kids, it sounds like. At that time, they were referred to PAIL support group, but they weren't ready. But then it sounds like a few months later, it may have been helpful. And they were wondering, what I think either current process or best practice, maybe from your perspective around hospital staffs being more proactive in following up after a certain amount of time for continual support. It also reminds me, the question I sort of had was, if you know of how this is being done really well in any communities from hospital to public health, that idea, I loved what you said around the clients see us all as a team, we should see us all as a team. So I don't know if you want to answer that in the best way possible around what you've seen, what you would suggest, or what the realities are around process.
Sure. So, I mean, I think that is not uncommon, unfortunately, that when families are in a hospital and are given information about support, very soon after their bereavement, they're not yet in a place to be able to even think about talking about that or meeting with other people. And that was certainly my experience as well, that I experienced my loss in August and didn't start going for support until March of that year. It really takes time for families to be in a place of readiness. And it is important to have somebody be in touch with the family and reaching back out to them. What we know about families who receive that kind of ongoing care from hospitals is that for many hospitals, it's very difficult for them to maintain those connections when they're no longer quote unquote patients of that hospital. And again, that's where public health can come in so beautifully to be able to be that bridge between that clinical piece in the hospital and when they're back in community. We certainly encourage hospitals when we're in touch with them to think about what that will look like and to be able to make those handoffs to other community supports that don't have those same limitations in terms of how that ongoing care can be provided. It would be lovely for hospital staff to be very clear about that and to recognize how that can happen. While I can't speak to hospital specific processes, that's something that we have heard from staff in the past, that it does feel good for them to be able to make a referral directly to PAIL Network, because then they also know that someone else can reach back out to the family if they're not able to or when they're not able to. And Megan, I don't know if you have anything that you'd like to add to that.
No, I think it's you answered it well, Michelle. The only other thing I'll say is it's challenging because often there's no dedicated person for long-term follow-up or funding. So yeah, it's challenging. This is where we often rely on public health.
Yes, and that's when we know, right? When we know we can do better. So I definitely appreciate both your answers there. Thank you. Another question that we had come in is building on that. If a client isn't ready to access support, um, any tips on how and when to bring it up again, or is it best to wait for them to bring it up when they're ready? And you've given some really good concrete examples in some of those slides, but maybe just to bring that back, if there's anything you can think of to help as a tip with that.
Yeah, that's a great question, because I think that it can feel really uncomfortable as professionals to feel like, well, I've had the conversation. I don't want to push and I don't want to be, taking my perspective and adding it to the family. I do think that it would be an important thing to have as part of your regular check-ins with the family, that you can talk with them about how they're feeling. And so sometimes even just checking with the family to say, I know we've talked about other supports in the past at the time you didn't feel ready. How are you feeling now? How are things going for you? Is there anything that I can offer to you? Sometimes things change. There's also ways for you, when you know about new things that are happening at PAIL Network, to bring it up in a different way. And so to let a family know about an upcoming event that is happening, or that there are awareness events that are going on, or things that you might have learned that there's a new resource available to families. That's another way that you can consider bringing up information to a family that wouldn't probably feel like you're just going back to the same conversation over and over again.
That's a beautiful suggestion, and reminds me of whenever we have difficult conversations, right? It's not about the what, it's about how, the how that you ask or suggest it. So that's a beautiful way to say it. And that's a really, I think, perfect time to wrap up, given that the time that we have. So as we wrap up today, thank you again so much, Michelle and Megan. I'd also like to thank my co-moderator, Andrea. And of course, a big special thank you for everyone who's joined and I know has benefited from listening to today's webinar. You can expect to receive a brief and anonymous survey for today's session. Please try and complete it. We really appreciate it. It just is so helpful in improving programming continually. And with that, I want to say thank you one more time and hope you all have a wonderful day.